So this week we have another lovely case. This is an 8-month-old British blue cat with progressive neurological signs. So let's have a look and see what the MRI showed. So we have a look at the MRI. There are some really severe and amazing changes in this particular case. So we have obviously the transverse T2 weighted image here on the left and the T2 flare here on the right. And obviously the most striking feature is the severe dilation of the lateral ventricles, which are causing displacement and compression of the adjacent structure. So here we see compression of the thalamus and this compression and thinning of the left cerebrum adjacent to the dilated CSF space. The flare obviously shows that the fluid here is similar in signal intensity to CSF because it's got good suppression. Some flow artifacts, which is quite commonly seen on the flare sequence. So in these particular cases, when we have suspect hydrocephalus, really the key is determining which of the CSF spaces are dilated and where's the cause of obstruction, if there is a cause of obstruction. So in this particular case, we see the primarily dilation of the lateral ventricles as we go caudally though. However, it appears that we have also extension of the CSF space caudally under the osseous tentorium. So if we have a look at the sagittal T2 weighted image, we can see that the dilation of the ventricles is primarily or almost entirely confined to the lateral ventricles. So we have sparing here of the third ventricle, which ventrally here looks relatively normal. There's some compression of the interthalamic adhesion. There's no involvement of the mesencephalic aqueduct, which is actually being compressed by this large extension of the dilated lateral ventricle under the osseous tentorium. So we have some here compression of the tectum and caliculae by this large supraclavicular fluid accumulation. The fourth ventricle seems unaffected. Due to the severity of the hydrocephalus, we have quite marked rotrocaudal compression of the cerebellum and really profound foramen magnum herniation. So here we can see quite a severe extension of the caudoventral veramis through the foramen magnum with this brainstem compression. So the pattern of dilation of the CSF spaces implies there's obstruction to CSF flow between the lateral and third ventricles. And when we look more closely at the lateral ventricles, we can see here in the left lateral ventricle, we actually have these abnormal membranes or cystic walls actually within the lumen of the left lateral ventricle. And the bottom of the images here we have the T1 post contrast, and this is a digital subtraction image. And we can see here we have the choroid plexus, which is actually on the periphery of the lesion and being distorted. And actually we have some thin linear enhancement of the membrane or certainly the wall of this intraventricular cystic structure. So we see it very nicely on the flare and the T1 weighted images, this apparent CSF-filled intraventricular cyst within the left lateral ventricle. We can tell this is chronic if we look here at the calvarium on the left. We see this displacement and thinning of the calvarium indicating the chronicity. The flare images show no signs of interstitial edema or periventricular edema. So this is essentially a chronic process with remodeling of the skull and quite extensive thinning of the adjacent brain parenchyma. So in summary, the MRI shows the presence of a large intraventricular cyst within the left lateral ventricle. Potential differentials would include an arachnoid cyst, a choroid cyst, ependymal cyst, or neuroepithelial cyst would be the primary differentials. Differentiating these intraventricular cysts is essentially based on histology, and there really isn't any reliable ways to differentiate them on imaging. The cyst is causing severe chronic hydrocephalus and secondary foramen magnum herniation. Given the age, it's likely that the cyst is congenital and would certainly explain the neurological signs. So hopefully you found that interesting, a very rare and unusual condition, but fascinating, and we'll interested to hear the outcome from Elsa later in the week.